There are numberless YouTubes discussing the topic of post-operative instructions or guidelines for dental implant procedures. However, the reason that you've come to this educational platform is to learn about the crucial information that nobody else is sharing with you and that is vital so that you can make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I've placed and restored 16,000 implants. In this video, we will discuss important factors such as post-operative pain management and swelling control, the do's and don'ts of diet, the oral hygiene tricks after surgery, behavioral precautions, and guidance for optimal recovery and physical activity. Our goal is to discern the truth from the media hype and present you with scientifically backed information. Your time is precious and your health is invaluable. Thank you for investing your time with us. After dental implant procedures, it is important to follow post-operative instructions to promote healing and minimize complications. While specific instructions may vary depending on the individual case and the dentist's recommendations, here are some general post-operative guidelines following dental implant procedures. Take the prescribed over-the-counter pain medication as prescribed by your dentist to manage any discomfort and pain. Carefully follow the recommended dosage and duration. This is scientifically important. To control swelling, apply an ice pack or cold compress to the outside of your face near the implant area for the first 24 hours to help reduce swelling, half an hour on and half an hour off, as long as it is practicable. Avoid drinking hot beverages and eating spicy foods as they contribute to increased swelling. To protect the surgical site, avoid playing or touching or disturbing the surgical site with your fingers, with your tongue, or any other object, for example, a tongue jewelry, to prevent infection and obviously irritation. Remember that scientifically the tongue is one of the strongest muscles in the human body relative to its size. Please be cautious while brushing your teeth, especially near the surgical site, and follow your dentist's instructions for proper oral hygiene. Gently brush your teeth twice a day, including the implant crown and abutment. Use a soft, bristled toothbrush and non-abrasive toothpaste. Another secret trick that we teach is to soften the toothbrush bristles under some lukewarm running water prior to brushing so that the surgical site will not be irritated by the bristles. As an adjunct, use an antimicrobial mouthwash or mouth rinse as recommended by your dentist. To reduce the risk of infection while eating, try and stick to a soft or liquid diet for the first few days after the procedure to avoid putting excessive pressure on the implant site. I want to emphasize that for patients receiving immediate replacement and immediate loading protocols, that they require a more specialized post-operative protocol, which we will discuss in more depth in episode 12 of the patient education series. Gradually reintroduce solid foods as advised by your dentist, and obviously chew on the opposite side of your mouth to minimize the strain on the surgical site. Obviously refrain from smoking or using tobacco products, as they can impair healing and increase the risk of complications. And because I live in the real world, I advise patients that if they are going to smoke, then please at least reduce the amount that they are going to smoke for 1 day pre-op and for at least 3 days post-op, which is the critical time for healing. This is in order to reduce the amount of carbon monoxide during this critical period. Simply put, in plain language, carbon monoxide is a byproduct of combustion during tobacco smoking, and the science shows that carbon monoxide binds to hemoglobin, which is the protein in your red blood cells, more readily than oxygen does. This reduces your body's ability to carry oxygen to the body's tissues. Avoid consuming alcohol, as it can delay the healing process and interact with pain medications that are vital. It is also important to attend all scheduled follow-up appointments with your dentist to monitor the healing progress and to ensure proper integration of the implant, and to discuss any concerns or issues that you have during these visits. Avoid strenuous physical activity and exercise and heavy lifting for a few days following the procedure to minimize bleeding and swelling. Light exercise is okay, and ensure to invest adequate rest to allow your body time to recover. It is important to note that the guidelines that we've just chatted about serve as a general recommendation, and your dentist may provide specific instructions based on your unique case. By way of actionable example, here is a synopsis of the confidential post-operative instructions that we provide to our patients over the past 3 decades who have undergone implant surgery under local anesthesia, and I need to emphasize under local anesthesia. From day 1 to day 3, they need to wash with warm salt water rinses 3 times a day. So that means 1 teaspoon of salt in a glass of warm water. From day 4 to day 10, chlorhexidine digluconate mouthwash, not chlorhexidine gluconate, after breakfast and after dinner. So that means rinse your mouth with 10 milliliters of the mouthwash for 60 seconds and then spit out, and then nothing to eat or to drink for 30 minutes after this. Please do not use chlorhexidine gluconate mouthwash, as this will stain your teeth if used for more than 5 days. I will provide the link to the correct mouthwash below. In my experience, approximately 10% of patients will swell. Use an ice pack every 30 minutes intermittently on and off the surgical site. When sleeping during the first 48 hours, use a slightly raised pillow. Do not eat chia or sesame seeds till your gums have healed. They are tiny seeds and can get into the surgical sites and contaminate the area. Do not eat spicy food that will burn the gums. Do not lean abruptly forward, especially if you've had a sinus lift, as you will feel disorientated. Take the prescribed antibiotics until they are finished. Use your finger with toothpaste to gently clean the area for 1 week after the operation, and I will demonstrate to you some tricks that we use for our patients. So the first is to use a finger-held toothbrush. So this can be used for babies and also for post-operative cleaning protocols. So you simply insert the little mini toothbrush, finger-held toothbrush, into your index finger. You apply some toothpaste, and then very gently with these soft silicone bristles, you can clean the area. The advantage of using your index finger is that you have the proprioception and dexterity in your finger to prevent you pressing or hurting yourself. Alternatively, you can use a thin piece of gauze, and you simply wrap the piece of gauze around your finger, like so. Apply a little bit of toothpaste, and then use the gauze very gently as a toothbrush to clean the surgical site in your mouth. Take painkillers like ibuprofen, codeine, and paracetamol only when you have pain, usually 24 to 72 hours post-op. If the pain persists beyond the 72 hours, please contact your dentist. If resorbable sutures have been used, they are biodegradable and will resorb naturally. However, if a suture comes loose after 24 to 48 hours, or if the suture is rubbing and hurting you, contact your dentist, who will trim or adjust to suit your comfort. Here's another secret tip. Using a black tea bag to stop post-operative bleeding in the mouth is a home remedy. Because tea is an astringent, or has astringent properties. An astringent is a substance that contracts tissues and vessels, aiding in healing and reducing bleeding, which can help promote blood clotting and reduce bleeding. Simply bite down on a cooled black tea bag to help stop post-operative bleeding after a dental implant procedure. Above all, always follow your dentist post-op instructions for the best outcomes, and reach out to them if you have any questions or concerns during the recovery process. If you find the content of this video valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember that the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast, where we will dive into the topic, can anyone get dental implants, and provide you with valuable insights.